no bruising, no squeezing, and it's predictive. Mammograms have zero predictive value toward the future. Thermograms can see an event coming a lot of times years before it becomes visible on like a mammogram. So it has much more predictive value, and therefore you're talking about early intervention. We know for an absolute fact that mammograms have not changed death rates for women. That is just black and white statistical fact. Okay, if women's death rates haven't changed, why are we still doing millions of mammograms every year? It's like, okay.
Well, I'd like to add to that point in that if the body is going to support the growth of a cancerous tumor, blood vessels go to that area to feed that tumor, and that is called vascular activity. So the thermography can determine that vascular activity before the tumor is even formed, and we all know the importance of early detection. And once again, when a woman has a mammography or mammogram, when many women have lumps in their breasts, they might be calcifications or fibrocystic lumps, and a mammogram cannot determine the difference if that's cancerous or not. So then they would recommend that the woman go ahead and have a biopsy or an ultrasound. A biopsy, if it is cancerous, that can release cancerous cells into the body. And then if it's not cancerous, the woman has wondered and worried that she might have cancer and has to go for this second procedure. So as you were saying, it can show future issues by that vascular activity.
So it's vascular activity you're seeing. I mean, are you seeing, is it inflammation, or you're seeing damage?
Sometimes inflammation, like June mentioned. If you've got a cancer there, you've got increased blood flow because the tumor is growing rapidly, so it has to have more blood vessels.
Right.
So that's what you're seeing is increased thermal activity, and that'll show up as a hot spot. But like I was mentioning a minute ago, like reflex sympathetic dystrophy, that's a decreased blood flow, so that shows up as cold. You can see
Thyroid.
Thyroid. If you're hypothyroid, a lot of times there'll be a cold spot over T1 on the back. If your gallbladder stirred up, there's a hot spot because that's inflammation. So you can see increased blood flow or decreased blood flow. So you can tell a lot of times what's going on with a certain organ.
When problems are indicated, what kind of treatments do you recommend?
You know,
depends on, I'm sure.
The job of this is not to tell a patient, oh, go get a gallbladder cleanse or go get your gallbladder out, or you know, at that point in time there's a general recommendation, like if your thyroid's low, you know, you should check with your physician about your thyroid.
Right.
Okay, so that's not our job to directly interface on a patient physician relationship.
But although if someone, say for instance, had a thermography and it showed that there was some risk, there wasn't a cancerous tumor at this point, but it might be headed in that direction, that would be a time that a patient might choose to work with, you know, balancing their pH. You know, all diseases grow in an acidic environment, and so I think that, as an example, that that when people know that they're headed in a direction, they can become more focused and be a little bit more disciplined about taking their supplements, you know, cleansing their, you know, their liver or their colon or whatever.
Many people who become interested in thermography tend to be a little more interested in their health, and so they're going to be interested in what they can do about the issues, and many of them in a natural setting too.
What do you call the thermography scans? Is it a thermogram?
Thermogram.
Thermogram.
It's like a mammogram, except better. And I mean, mammograms actually increase risk of cancer? Is that?
What are mammograms?
Yeah.
X-rays.
X-rays.
What do X-rays cause?
Radiation.
Cancer. We've known that. The lady that discovered X-rays, what did she die from? Cancer. Madame Curie.
Yeah.
Why does an X-ray tech stand behind a lead shield? Because X-rays cause cancer. Why do they wear a radiation badge? To see how many X-rays they've gotten. X-rays cause cancer. So it's an oxymoron. We're using X-rays to detect cancer that cause cancer. It's like,
But also, you had spoken about women that had metastasized breast cancer without having the initial tumor.
I've actually, with the process of mammography, any lady knows your breast gets kind of smashed, and that can be painful. But there's another problem there, and that is that any woman over age 50 will probably have some cancer cells in the ducts of their nipples, okay? That doesn't mean they're going to die of breast cancer.
Right.
That's called ductal carcinoma in situ, DCIS. Those cells are living very happily there, and the body's and everything's contained. They're in a specific place, and the immune system has them under surveillance, and they're not going to die of that. But you take and smash, and you can pop one of those cells out of there. I've actually had 2 patients in my practice that had spread breast cancer without ever having a primary breast tumor. And they were both faithful mammogram goers. I suspect that with the smashing process, they popped one of those ductal cells out of there. It traveled through the lymph system to the liver or bone or wherever and started growing there. So, and so you're bruising and damaging the breast tissue, and then you're using x-rays. Damaged tissue is much more susceptible to radiation damage.
Yeah.
So I don't get it, but
Yeah, I don't understand. My father had prostate cancer, and I couldn't understand why radiation was a treatment for that. I mean, is that along the same lines?
I think it's what you win the battle, but you lose the war when you do deal with the types of treatments that are suppressing or treating the cancer tumor. I'm reading an excellent book right now. It's Cancer is Not a Disease by Andrea Moritz. Mm-hmm. And he talks about when in any disease, when you deal with the symptom and not the underlying cause, cancer is a symptom of an underlying problem. Then the underlying problem is going to spread. And that's why you hear so many times when people have chemotherapy or radiation and they're cancer free, and then 2 years later, all of a sudden it's in their liver, their brain, or whatever.
Right. Obviously they were never cancer free.
Mm-hmm.
So when it ever does rarely go into remission, is that just your immune system kicking in and fighting it off for a while, or?
Absolutely. Here's the critical moment. Unless your immune system rises to the occasion, you will not survive your disease. And that is the crux, the very essence of the issue with chemo and radiation. They damage your immune system.
And acidify the body.
And acidify the body. That's why you're always drawing a white blood count. Well, that's your immune system to make sure it's not too low to give the next dose. Well, why are you checking the white blood count? Because what chemo does is it damages rapidly dividing cells. Normally, the most rapidly dividing cell in your body is the immune system. So it's a race. Which you're going to kill first, the cancer or your immune system? So, but if you ask an oncologist, could this chemo ever kill 100% of the cells? The answer will always, every time, be absolutely not. It will never kill 100% of the cancer cells. And you go, okay, well, if it's not going to kill 100% of the cancer cells, and I'm going to live, what's going to kill the last 20 or 30% of the cancer cells? Oh, well, your immune system. Oh, well, I thought the chemo damaged my immune system. Well, at that point in time, you usually get a reaction because you've pulled the curtain
right
from the wizard.
Yeah.
And they've been discovered. Oh, and then there's irritation and fluff and bluster, and because chemo damage is the only thing that can possibly save your life. If your immune system doesn't rise to the occasion, at the end of the day, you will not live. Let's think about it in other terms. AIDS patients, they all die of an infection.
Right.
Why? Because their immune system can no longer rise to the occasion, and there is no antibiotic under the sun, no antiviral, no antifungal that ever kills 100% of the bacteria, viruses, or fungi. At the end of the day, the immune system has to mount up and overcome that last 10 or 20%, or you won't survive. And the minute that your immune system will not rise to that occasion is the day that you die.